Well, this is a virus, it's called the Zika virus, that was initially found in Africa in the 1950s and only recently was discovered in South America, more specifically in Brazil. Typically, it is a virus that's called vector-borne. In other words, it's transmitted from you to me via mosquito. It's a certain type of mosquito called the Aedes mosquito. It's important to know that. Now, that mosquito only breeds in tropical countries, so in South America, hotter, warmer countries, Africa, and so on. And up until very recently, October of 2015, we just thought it caused, if you got the infection, 80% of the people didn't know they had it, but the 20% that had it, mild fever, malaise, headache, and so on, it goes away. What they realized, however, so you had the fever, the rash, the joint pain, and the red eyes, and those type of things. Now, what they also realized, and this was more from epidemiologic studies, is all of a sudden in Brazil, in October, November, they realized there were 3,500 babies born with small heads. They're called microcephaly.
3,500
Yes.
babies within the month.
Yes.
And what has happened with these children?
Well, these children are obviously born with an underdeveloped brain. And so something went wrong in the pregnancy because what happens is the brain forms in the first few months of life, of pregnancy. And so all those formations and when viruses can get into the bloodstream through the mother to the baby, certain viruses have this capacity. Now, we didn't know about this Zika virus, so people have kind of linked the Zika virus with these problems in babies. And having a small brain means that you're probably going to have lifelong issues in terms of being able to develop properly and mental retardation and so on. So we're worried about the long-term outcome. And so the World Health Organization has kind of raised the alarm and saying, now, we're not sure, we're going to study more of the linkages, but it's really too much of a coincidence to discount it, right? So what they're saying now is if you're going to be going to areas where this virus is predominant, more in the southern hemispheres, and where that mosquito is prevalent, so the Aedes mosquito, you have to take precautions. Obviously, if you're not pregnant and get the infection, nothing's going to happen.
Maybe a cold, like
maybe
all those
like a
things that
cold,
you
fever,
talked about.
rash, and so on.
But if a woman is looking to get pregnant, is maybe in the early stages,
Yes.
if she got bit by this mosquito, she
Okay.
really wouldn't necessarily think anything of it until
Exactly.
the end result of
And
what happens to the child.
that's the problem. And so people are now saying that if you're going to go to those areas, speak to your healthcare provider. Go to our website eohu.ca or go to Health Canada website, and it'll tell you which countries to be leery about. So I think that the bottom line is, like, I don't want to panic people as well. But on the other hand, if you're pregnant or planning to be pregnant, either avoid going there or take the appropriate precautions. Speak to your doctor now.
What would appropriate precautions
Well,
be?
first of all, two things. Number
Okay.
one, some of the what we saw before were showing people insecticides and so on. We got to control the mosquito population and also take precautions like we do when we talk about West Nile virus. Like, it's funny, I'm talking about that now in January, but in June when I talk about West Nile virus, same precautions: long sleeves, everything that you do to avoid mosquito bites and mosquito pooling and mosquitoes living in the area.
Okay. These are cases that we don't want to see here, but 3,500 cases in Brazil in that one
That's
month.
right.
It's alarming, and we want to get the information out. Where can people go to read out and understand
Well,
more?
our website, eohu.ca, has a link to Health Canada, the CDC, and I just wanted to say that this mosquito does not yet live in Canada. And so
No.
we had a case in BC. Somebody came from down there who had the infection, but that cannot be transmitted because we don't have the mosquito. So that's a good news for us.
Right.
But if you're traveling down there, you got to be leery.
Keep that in mind. Check out the website. Look into the information, especially if you're pregnant, looking to be pregnant, and are traveling to those destinations.